Kolcaba's comfort theory in anxious pre-surgical patients. Katharine Kolcaba's comfort theory is used to aid nurses in creating holistic care plans and comfortable interventions. It helps determine unmet comfort needs. It helps nurses create measurements of holistic comfort for documentation. It focuses on providing three types of comfort, which include relief, ease, and transcendence. The comfort is provided in the physical, psychosocial, environmental, and sociocultural contexts. Clinical question and importance. My clinical question is how, using Katharine Kolcaba's comfort theory, can adult patient anxiety regarding upcoming surgical procedures be reduced? This question is relevant because pre-surgical anxiety can have a lot of negative outcomes for patients, including an increase in body temperature, increased release of hormones, heart rate, and blood pressure. It can cause electrolyte and fluid imbalances. It can cause a reduced immune response, increased inflammation and wound healing time, and overall negative surgical experience for patients. So this is my initial concept map. So how can patient anxiety regarding upcoming surgical procedures occur and what causes it? So my thoughts were fear of the unknown and losing control, risk of addiction to medication, denial of requested medication, being perceived as weak, feeling inadequately educated, and negative previous experiences or that of others could contribute to the anxiety. So, this is my final theory informed conceptual map. So, the healthcare need is decreasing pre-surgical anxiety for optimal surgical outcomes and increased patient comfort. Nursing interventions I thought that could be included and that evidence has shown in my research was music therapy, like playing soft music in the suite and allowing patients to bring their own, if applicable, perioperative education and enhanced communication. So, making sure the surgeon speaks with the patient and that they understand the language used. Emotional support from family members and medication if needed, something like Versed. Um, Intervening variables would include patient age, gender, surgical condition, and physical and family conditions. All these things would lead to enhanced preoperative comfort, which would lead to perioperative health seeking behaviors like internal and external behaviors that would all improve patient surgical outcomes and decrease anxiety, which I will go into further. Um, these perioperative health seeking behaviors would lead to increased institutional integrity, including things like increased best practices like reduction in post op complication and readmissions, and best policies, so creation of new facility guidelines to treat perioperative anxiety. The anticipated outcome of these internal and external behaviors mentioned previously would be decreased anxiety in patients anticipating upcoming surgical procedures, which would lead to outcomes like acceptable physiologic parameters met like blood pressure and heart rate. The patient remains optimistic and less anxious. The patient is ready to handle recovery. They adhere to discharge instructions and pre-surgical plans. They participate in preoperative care. They advocate for themselves. They do not cancel their surgery. And there is an improvement in facility practices and policies. So, the final takeaway that I would want my peers to know from my project is that pre surgical patient anxiety can have profound effects on patient physiological and emotional well being. It can drive patients to cancel surgeries and lead to negative health outcomes for their surgeries overall. Kolcaba's theory focuses on increasing comfort and decreasing distress, which is why this is the perfect theory to use for these anxious pre-surgical patients. And not only that, but Kolcaba's comfort theory could be used in many settings. Things like hospice and mental health would also be very viable options for using this theory. And the Kolcaba's comfort theory can improve facility policies and practices overall. And here are my references.